Hello, I'm here to tell you about Vitälzyczm hybrid powder caps. I'm Dr. Donese Worden, a naturopathic medical doctor practicing in Arizona, as well as lecturing and conducting research on nutraceuticals and medical devices. I only tout companies and products that I know have quality assurance, and I have personally seen many benefits for my patients with Vitälzyczm, and it's a company that I trust. Vitälzyczm hybrid powder caps are a blend of systemic and digestive enzymes, as well as antioxidants and flavonoids. Remember, it's a hybrid. So the good news is, if you're only going to get patients to take one enzyme product, this is one for you to consider for the systemic and digestive support. It's enteric-coated and vegetarian, coming from plants and lab-grown bacteria. This permits the enzymes to operate in an extremely wide range of pH. Enzymes come from the two sources. Fruit and enzymes, ANMA and rutin, are from organic plantations, and the seropeptidase, protease, and proteinases are lab-grown in a protein fungal medium. Enzymes are extracted so there's no trace of fungus left on the enzyme and the purity is assured. Vitälzyczm uses pure, non-GMO, high-potency enzymes rather than extracts. These are important distinctions from other enzyme products. This product has been a flagship for World Nutrition for 12 years, and there are many testimonials for multiple symptoms for adults, children, and pets. And when I was first comparing Vitälzyczm with other enzymes, I was impressed with the dosage strength. You can prescribe less capsules, for which patients are always appreciative, thus saving money for the patients and in the long run increasing the compliance rate. The ingredients include protease, which catalyzes the breakdown of proteins into amino acids, and peptide fractions for the best absorption and assimilation. Seropeptidase is a mainstay in a good enzyme product. Very positive effects have been shown, such as varicophlebitis in the treatment of those lower limbs, and other studies have shown beneficial effects on mucus clearance by reducing the neutrophil numbers and altering the viscoelasticity of sputum in patients with chronic airway disease. It was concluded that seropeptidase has anti-inflammatory, anti-edemic, and fibrinolytic activity and acts rapidly on localized inflammation. I also use this for acute respiratory conditions, especially with those with the mucus patterns that we've discussed. Also showing effect is things like carpal tunnel syndrome, the neuroprotection, and the reduction of post-operative swelling. Multiple studies have shown support for pain and inflammation from papain and bromelain, along with amylase. Those are the digestion of carbohydrates, and the lipase takes into effect the breaking of the fats into fatty acids. Rutin addresses the strengthening of capillaries and connective tissues. It also has neuroprotective effects and is being utilized to treat severe gastrointestinal disease, diabetes, and new research shows that it may inhibit platelet aggregation. AMLA extract is an added antioxidant rich in vitamin C, protein, cellulose, calcium, and tannic acid. Vitälzyczm provides a recommended dosage chart for you for many conditions, and this chart may help you know of more potential uses. You can utilize activating or loading dosages until the patient feels relief. Maintain that for a few months and then you can reduce the dosage. Best is to take on an empty stomach, or at least 30 minutes before a meal or 60 minutes after a meal for the systemic effects. Patients may notice relief from 3 days to 2 weeks, usually shorter if you're taking into account utilizing that loading dose. There are some reports of mild detox reactions. I haven't seen any in my practice, but something for you to be aware of. With leaky gut and colitis, inflammatory GI conditions, I implement glutamine, NAC, just a few days before beginning enzyme therapy. The enzymes themselves, however, do speed that healing process along, so don't wait too long to implement it. If used in conjunction with other supplements, it may increase their efficacy as well. Contraindications: anticoagulants or blood thinners. You should be monitoring the ProTime and INR in those patients, and if you are, I have successfully weaned off those patients off the medications and into enzymes. Also consider decreasing dosages with antibiotics, as the enzymes affect the vascular permeability, so the absorption of the medication may be increased. This hybrid, systemic, and digestive enzyme has been around for a while for a reason. It goes back to this saying, tried and true. Now I encourage you to try it. Thank you for watching.